This meeting today, there is a progress. They gave a commitment that within 6 days, by 5th of March, we'll have this complied with. Again, today they have given a commitment to have all the doctors given the medical cover immediately, and then doctors in postgraduate studies for their fees that is housed at the Ministry of Health be paid by 5th of March. And then we have the interns who are medical interns, the 1,000 of them to be posted by mid this month. So they've given timelines to all these activities. So in the spirit of bargaining and with our notice of intended strike, we then put a timeline and a program to have this implemented within 60 days. We have many consultants, we have many surgeons, we have many gynecologists, we have many specialities in the counties that on the posting order, where they work in the hospitals, they are actually specialists. But the mannerism of their pay slips, they are interns or they are junior doctors in their payrolls. And that one has come out very clearly, and the counties are committing to promote those particular doctors immediately. So the transformation that need to be seen in NHIF need to make it attractive first to the government that runs it, because these are members' money. The bigger percentage of these funds, both the NHIF and the NHIF fund, need to actually go to public hospitals. And that can only happen if there's good mechanisms to employ and to equip these public hospitals in both the county and the national. But with most of this thing goes into privatization, then the cost of healthcare will increase. It will triple and it will go higher as time goes. Because the biggest driver to a higher cost of healthcare in the country is privatization of healthcare. It will be left for the few who can afford, and the majority who can't afford will be able to continue the fundraising, and therefore the realization of the universal health coverage will not be seen.